um TikTok at the same time.
Good morning, Frank. How are you?
All right. How are you?
Doing okay. Living the dream here in Bridgeton, Missouri. It's not
Okay.
really a dream, but it's where we work. So
It's a nightmare.
yeah,
Nightmare on Elm Street, but in Bridgeton.
yeah. So appreciate you coming back on because somebody had some technical difficulties hitting record.
Well, and then I had technical difficulties with this computer, and I was just like, I swear I practiced, and so then we just went to the iPad, pivoted.
You know,
It works.
It's my life.
Technical
I can't move my
difficulties.
head.
Technical difficulties are your Super Bowl.
They are.
I know.
I
know.
don't get stressed out whenever I plummet.
No, you do. You do. But let's not go
Let's
there.
talk about you.
Let's
Frank.
talk about you, Frank. So, Frank, you're looking good. You're not
Thank you.
hospitalized. Those are all 2 pluses.
Yes.
Tell us how you're doing and what's on your mind this morning.
I'm doing okay. Like I said to you the last time we spoke, well, Claudia, that this is my last. I have one more week of chemo treatment, and I'm done. So I get to ring the bell.
Yes.
You'll have to take a video of it.
Yes, it's actually a week from today. So I can't wait. So I'm looking forward to that. That's been a long haul, up and down haul, I have to say. I haven't lost all of my hair, at least.
You have more than my ex-boyfriend.
Okay, stop. You know what? The hair becomes the least of the problems when you're battling cancer. So is it IV chemo you're doing or oral or what kind of chemo? IV, okay. But it really does take a lot out of you to go through stuff like that. And it changes who you are. How long have you been dealing with cancer diagnosis?
It's almost a year.
A year, okay.
Congratulations on completing your chemo.
Yeah.
The one good thing is I got diagnosed early enough, so they were able to get to it quicker. So that's why. I mean, a lot of people that I've talked to that have been sitting with me over there at the treatment center, they've been there for over years, like 2 years, 3 years even, and so I'm lucky. I have to say I'm lucky.
You are. You're lucky that you have good access to care, but that's only because you've had to fight for every freaking thing your entire life. So you're like, cancer? Okay, I know how to deal with this.
Let's add this to my rare disease.
Right.
Plus, I got misdiagnosed with cancer in 2004, lung cancer. So I actually went through 4 years of chemo and radiation for something I never had. So yeah, I knew what cancer was all about.
Wow. 4 years of chemo that wasn't even a cancer?
Yep.
How does that happen?
They misread the biopsy back in 2004 down in good old Florida. So I went through 4 years. They said I had lung cancer. Then in 2011, I finally got re-diagnosed with it was actually sarcoidosis instead of cancer.
So the treatment for sarcoidosis is a little bit different from chemotherapy?
Yes. There are some chemo that actually works for sarcoidosis, like methotrexate. They use, but it's always the pill type. Not always, mostly the pill type.
Yeah, we use a lot of methotrexate in the rheumatology world, but they're such low doses that the patients don't have side effects from it. It'll be like a once weekly dose of, maybe 5 or 8 pills that are 5 milligrams, or actually 2.5. So it just kind of depends.
How did insurance handle you getting misdiagnosed? Like, how did that payment go about?
Um,
I actually didn't have any problem with that.
Well, because in 2004, the insurance companies weren't sitting in between the physicians and the patients. So they're probably thinking that's a win because that they weren't involved. So, but
you're involved in a lot of organizations and educating people. Do you kind of want to tell us about you?
Okay, yeah. I started my own organization in 2011 called Sarcoidosis of Long Island. And then 2020, I started another organization called Stronger Than Sarcoidosis. I made that organization to make it a little bit more national. sarcoidosis of Long Island just sounded too regional. So, yeah, so I made it the Stronger Than Sarcoidosis. I've been part of other organizations called like Every Life Foundation. I've been working with them since 2012. I've been working with NORD, which is National Organization for Rare Disorders. About
I'm in that.
about the same time.
Your head there.
Yeah, you're part of that as well. Yeah, so I've been working with them. I'm actually part of a patient senate right now for Patients Rising.
Awesome.
And that one is actually a good company that I really want you guys to get acquainted with, because they're working directly about with bills for PBMs.
Yes, yes. Patients Rising, I think that we are in contact with them, aren't we? Is that?
But we're going to be going live later today with Put Pharmacy and Angry Dad about some PBM reform. So I think we're going to go live around 12 our time.
Okay, so I'll check that one out too. Yeah, because I've been working a lot with the PBMs myself at this point. And I just got into it recently. I've always had trouble with my insurances. And
right.
So, but I never really knew about the PBMs until probably about 3 years ago. And also the co-op, the co-pays and stuff like that. You know, I knew I was having trouble because I was taking Remicade. Because the sarcoidosis does affect me in my rheumatology and my bones, and it actually is in my bones as well. So I have to deal with a lot of rheumatology medications. So I had to take Remicade, and I had to fight. Even the one I'm on now, I'm taking Simponi. And thank God I have a great rheumatologist myself. They actually fought for me. I didn't even have to call, but it took them 3 times to get it passed, which was crazy. But yeah, they did everything, and I didn't have to fight for they did it without me.
And are you doing Simponi Aria or the Simponi subcutaneous injection?
I'm doing the IV.
Okay, the Simponi Aria, it's a great medicine.
Yeah, we have it's working real well.
Yeah, I mean, it's such an easy 30-minute infusion every 8 weeks, and patients really do well on it. And also, J&J, the makers of Simponi Aria, have a great copay assistance for commercial patients. And are you aware that they'll rebate you your administration fees?
No, I did not know about that.
Okay, so if you Google J&J Simponi Aria administration rebate, you can fill out that paperwork and send in your EOB, and J&J will refund you all of the money you've had to pay for the administration of Simponi Aria.
Oh, okay. Wow, I didn't know that. I'll have to do that.
For sure, because sometimes the administration is $20, but sometimes it's $100.
Yeah.
And if it's at a hospital, it's like $500.
Yeah,
so
exactly.
Definitely look into that, you know?
Yeah, so Remicade, I had to personally fight for Remicade myself. But this one, like I said, I have a new rheumatologist. Unfortunately, my other rheumatologist retired in June. So I had to start all over again with somebody new, which was rough in itself. But I was able to get a really good one. One thing that I have been lucky, all my doctors now are in the same hospital.
Beautiful.
Yeah, so have one patient portal instead of 5 different patient portals, and it has been great. And they all talk to each other, and it's just such a smooth transaction now.
That's amazing. But you understand that you're at the helm of this thing, pushing this whole thing, and a lot of patients don't know where to start, and they're overwhelmed. And because you've been living with rare disease for such a long time, you are an expert. And it's amazing though that you can rally a good rheumatology and your whole medical team together. So
well, you're such a testimony. You've been given so many like pushbacks, and you're still here smiling, like with a good attitude. You're not negative at all. It's just people could learn a lot from you.
Well, the thing is like when I talk to patients, and I always tell them, they're like, "Oh, I don't have it as bad as you do." I'm like, don't compare. I don't compare any patient. We all have our trials and tribulations, but we also have our own group together that you're not alone, and so you can talk to other people. And once you realize that you aren't alone, it's a better fight. It's an easier fight. Fighting by yourself, I know, like I've told you before, 2015, I felt alone, and unfortunately, I almost committed suicide. And I actually had to put myself in a 72-hour watch at the local hospital, and I learned a lot. And I have a counselor and I have a psychologist, but my counselor has been with me since 2011, and she's been through all of this. And before I actually attempted, I made a phone call and I called her, and she told me, you know what, you don't want to do this. And I'm like, yeah, I do. I have everything literally on my desk. I had it right in front of me. And she's like, no, you called me. She's like, if you wanted to, you wouldn't have called me. And that just like changed my whole outlook in life. And and then going through this, I speak to a counselor once a week, and I see a psychologist once a month. And I'm not afraid to say it. I'm not afraid to tell anybody. I always say, you are weak when you don't ask for help.
Mm-hmm.
You need to ask for help. And I know it's very hard for men to ask for help, and I'm really pushing for men to really start, asking for help. It makes you strong when you do ask for help. And there are people out there, whether it's a counselor, whether it's a psychologist, whether it's your church or whatever, or just somebody to listen.
Mm-hmm.
And there's always somebody there, and you have to do it. I mean, you can't do this alone. I really say you can't do this alone.
Yeah. What an amazing story, and a beautiful story you have, though, because I fully agree with you, though, because when you're in a bad place and you meet with yourself, you're not going to get anywhere. You got to reach out. You got to reach out to somebody, neighbor, friend, advocate, doctor, counselor, whatever, because this will become a blip, hopefully, in your story. And the lives that you've been able to touch, and the people you've been able to, inspire, that's a lot. And I mean, one of your stories, one of your diagnoses could have crippled you, but it didn't. Like you said, it made you stronger, and it changes who you are when you walk through really shitty things.
Yeah, exactly.
I can tell you that I've been walking through some really shitty things myself, and it makes you recognize that you want this,
and you can curl up in a ball or cry, or you can make the most of it with a smile.
Mm-hmm.
One of my very first specialist, sarcoidosis specialist, he came up to me and he said to me, fighting this battle is going to be 90% mental and 10% physical. And he goes, I may be exaggerating, but he goes, if your mind gives up, I could give you any medicine and it doesn't matter because you just gave up. Your mind is really it's what's going to control you. So you have to decide. And he goes, I'm going to be very honest with you. He goes, I have I think at that time he had 1,500 patients. And he goes, so if you're not going to fight, tell me now. He goes, because I have 1,500 patients that I have to deal with. So, who want to fight. So, so that's what, he really put it in perspective for me. He really did. And for a doctor to say that it's mental instead of physical is something interesting.
Well, I think I've even noticed like people that come in just looking for the worst, just seeing bad everywhere, it takes a lot longer for them to almost heal because they can't focus. They're so focused on just staying negative that they can't even focus on letting their body heal. So it's like, I had this manager and she fell down the stairs, broke her hip and like leg, and she was the most negative person ever. I fell down the same stairs, not a broken bone, kind of correlating, very off subject, but that's what I add. That's what I'd like to add.
That's her 9 personalities ragdolling down the hallway here.
And Julie openly talks about my 9 personalities. So we create a platform
Right?
that welcomes everyone.
Right, very inclusive. You know, it's one thing when you can get an assistant that has 9 personalities, I get 8 times more work.
Oh yeah, there you go.
The creative juices just keep flowing.
Well,
Yeah.
so what would you want to tell people that are just getting started in advocacy? What would your message be?
The first part, of course, is be your own best advocate. You have to fight for yourself, because in the scheme of things, there are going to be some people who will fight for you, but you need to fight for yourself. You need to be informed. I have one thing that really hits me is that I took a medicine. This was the very first rheumatologist I had, not knowing my disease, gave me this medicine, and I also have IBS, so gave me a medicine. Can't even think of what it was, but it affected my stomach. It actually put a hole in my colon. I got diverticulitis, and I went to the hospital. My brother-in-law literally had to carry me. Thank God I'm a small person. But yeah, he had to carry me down the stairs into the car, and we went to the hospital. The hospital was going to send me home because they only took an x-ray, and they're like, we don't see anything. And I'm like, no, I can't even move. I can't even walk. I don't go to a hospital just for the sake of going to the hospital.
Right.
Like, you need to do at least a CT scan and see what's going on. So finally, one of the emergency room doctors finally, gave in and said, because I said I'm not going home. That's what I told them. I'm not going home. And they found a hole in my colon. And they were like, you need to go into the emergency room right away. I mean, into the surgery room right away. And I'm like, okay. And then while they were in there, they found sepsis in 99% of my body because of this hole.
Wow.
So if I would have went home, I would have been dead. There's no, the sepsis would have killed me. So you need to be your own best advocate. I mean, because you know your body. You know your body better than anybody else. So that's the first and foremost. The second thing is, like I said, you're not alone. There are people out there that, there is so much more knowledge now than when I first got diagnosed with this disease and any rare diseases. There are just so many people out there. Those groups that I said, earlier on, ask for help. They're there to help. They're there for the whole rare disease population, or like Patients Rising is actually for all of healthcare, any kind of disease. So, I mean, they are there. They want to help. Don't be afraid to ask for help. And then when it comes to mental as well, don't forget about, I say mental health and physical health is all part of your healthcare. It has to be.
Yeah.
You can't just take, I mean, I know the physical aspect is always going to be there, but you can't just work on that. You need to work on your mental health.
Yeah. Especially in this day and age, there's just so much coming at patients. And I was just, move your head over a little bit.
Sorry.
I was just reading an article this morning on United Healthcare's algorithm is set to identify people that utilize mental health services and to deny them. And it's like, oh my God, like, how did we get to a place where these big insurance companies have siphoned so much money away from patients and physicians and that interaction to themselves? And then they turn around and screw the very people they swear to help. Like, this is so broken.
Well, and this message is too,
I'm always
because
telling people that you need to call people out. If you don't call them out and hold them to what they're supposed to be doing, they'll let you go. They'll let you know. I mean, you'll be one of those statistics. You don't want to be one of those statistics.
No, I was actually joking with her a couple of years ago saying, hey, I wonder if United Healthcare should start selling caskets or reusable caskets for their members, because that's really a good place for them. They claim that they're, some trusted healthcare partner. No, you're not. None of these insurance companies are. There's nothing trust about it. If you trust someone, you answer their phone calls, you connect with them, and you engage.
Yeah.
And
that's
you
not-
sharing your story is amazing, because if my brother, for instance, had been
Much
given
alike.
the same information, if he'd had known he wasn't alone, he probably wouldn't have given up and then thus dying at 30. I think your hope and like your outlook has made it to where you've changed the trajectory of your life completely, because you could have given up like most people would give up.
Yeah.
And you're
2018
spreading information.
Yeah, in 2018, I was told I had 6 months to live.
Wow.
Here I am, 6 years later, and I've actually joked to my doctor. I have the same doctor. I kept him, but I told him I'm not going any. When he told me that, I said I don't have a toe tag or an expiration date on me, so you can't predict when I'm gonna die. So, and I left the office, and I came back to him, and I worked with him. I still work with him, and I'm like, my 6-year anniversary was April, and I was like, I came to his office. Here I am, and laughed at him. But yeah, you have to have a good attitude.
Well, I mean, at the end of the day, we all get to do this one day at a time, right foot, left foot, keep moving forward. And there's a lot of hope. And that's what, as a rheumatologist office, what I tell people we sell here is hope. I've got lots of drugs and lots of tools in my toolbox, but we will take your insurance company and your pharmacy benefit manager to the mat, because rheumatology patients are not one size fits all. They're not even one size fits most. We need customized plans. I don't give a rat's behind what the Optum RX or CVS or Express Scripts needs to make more profits off. This is about a physician's office and a patient, and you are such a big part of that, and it's inspiring to see how you walk through this with grace.
Yeah, but it's great to see you guys doing what you do, because there are a lot of, unfortunately, doctors who don't have the time to do that, or doctors' offices that don't have the capability to do that as well. And it's so great. Like when I found you guys on TikTok, I was just like, wow, I need to talk to these people.
Yeah, well, that's Dr. Bach's legacy. He insisted that we have an advocacy department, because he was always like, get that insurance company on the phone. I want a doctor on the phone today. I'm like, but they said 10 days. He goes, I'm not interested in all that today. And he was always sitting on ready. Therefore, we're sitting on ready.
And Dr. Bach, he goes, Julie's said one person has helped her the entire time she's worked with me. Only one person out of the entire staff has been able to help her, and that's you, Claudia. And I'll never forget that, because I'm like, now I got to do it perfectly.
Right. I mean, you know what we all have in common is we're all patients, and we've all been denied or delayed by our insurance company or pharmacy benefit manager. So you give me a paddle, I'm rowing for the shore. Whatever it is, I'm doing it. So I so appreciate you. It's wonderful to see you again, my friend.
Yes, thank you.
Carry on, do your best work, live your best life.
Keep us updated.
Keep us posted. And have a happy Thanksgiving, my friend.
Don't back down.
And don't back down.
Okay. Yes. Thank you.
Frank.
Bye-bye.
Bye-bye.
Oh my gosh.